Pain at any point of time is not normal. Any pain happening on a routine basis, it's not normal.
They had to go to the doctor for the reason that they were unable to consummate the marriage.
Sometimes I also see couples who are 9 years down their married life. But the basic thing is I'm not able to consummate the marriage. But these topics are such topics that there is no clear picture unless and until a doctor themselves they talk about it.
So some people also go through that mental trauma or psychological trauma.
It's randomly to everyone. It's important to know their body. Sexual intimacy is something which both the partners should enjoy. They live longer also.
What exactly is the age when the fertility starts to decline?
20 to 25% before 30 years of age. It will slowly decrease to 15% like that post 30, and by 35 it will come to 5 to 10%, and 40 it will become 1%. As a doctor, it's very advisable for a woman to conceive before she's 30.
Or women like senior police officers or young police officers or any challenging situations, or some sportswoman. In that situation, it becomes very difficult.
That is why they say women are great. Because they handle so many things.
Absolutely. Welcome to the Honest Hour, Dr. Maalvika Appasani garu.
Thank you, Shashank garu. So nice to be here.
Same pleasure is mine, ma'am. Usually, when it came to Fair and Lovely, now there's a severe backlash, when we talk about fairness creams and the stigma around it or the prejudice attached to it. But these days, another unspoken about thing is about lightening or using lasers, using some pigmentation or hyperpigmentation creams for intimate areas, what they call as the bikini bodies, etc. So what are the side effects of this, and what are the right approach in this?
So firstly, what every girl or woman should understand is their intimate parts are little darker than their other skin, like some face and all, they are more lighter in color. And when it comes to intimate parts, they are little darker than their normal skin, and
so
that's
it's biologically normal.
Yeah, that's normal, and they become more dark when when they attain the process of menarche and all, because of the hormonal surge it will become. But few people who are having conditions, hormonal imbalance, hypothyroids or PCOS issues, it's more darker. Okay. Or few people who are into some athletic thing and they have lot of friction in the intimate area, obviously because of the friction and all, it will get more darker. Okay. Or for some people who are repeatedly doing something like shaving or anything, something like that, then it gets pigmented or irritation, and they get acne, and like that it gets infected, and recurrent repeated things make it more and more pigmented. So when it is like that, they are obviously insecure. They'll come and tell us, priorly it was not like that, priorly it was fine, now it is like that, so now what to do? So then again we have to explain them. First thing is first stop the cause. So whatever is causing it, we have to tell them, now stop it. Right. Then comes the treatment part, what we can do. So if we are not treating the cause, there's no point, going for treatment. How much ever they do, how many ever products they apply more and more, but finally there is no result. It's no good for them also.
There are also reports that they're applying bleaching, creams, chemical peels, etc. What is the long-term damage that it can have on the woman's health?
All these bleaching and all that, they irritate skin.
Do-it-yourself methods.
So, and when they don't know what to do, where to stop, how to go about and all that, obviously there is a lot of skin irritation. That's the intimate area also. Once it gets repeated irritation, it gets inflamed and it causes more and more pigmentation. So when they want lightening, it can get hyper also, not hypo. So the skin part gets more irritated, the pigmentation might improve, it can cause infections. So lot of things are there if they go for themselves treatment rather than going to a doctor and taking it properly.
Having understood that, like you mentioned about sometimes shaving, etc. So many people do not know what is the right direction to deal with pubic hair. Right. So some people apply razors, some people apply some kind of chemical ingredients, etc. So what is the right approach, as a gynecologist, what is the right approach?
So initially the human body is, it's well curated. I don't know how it's curated. Maybe by God it's curated, but it's well there. So the pubic hair is there for a reason. So generally pubic hair is also it's supposed to provide, the hair follicles have that nice oil which produces from the follicle. So it's supposed to keep that area a little bit of oily, not too dry, and it's supposed to help them from the impact, like it's supposed to be protective.
Okay.
So people who are comfortable with the pubic hair, no need to do anything. They can just leave it like that.
Right.
And then, but people who are not comfortable with the pubic hair, they are going for other modalities like either waxing or shaving at home.
Salon waxing.
Or some using products which are like, it's a cream. After just applying the cream, the hair is supposed to fall off, chemically removing the hair. So this thing might cause irritation of the skin, more dryness, and when they are doing shaving sort of a thing, there might be micro cuts in the skin which might get infected, because it's an intimate area, it might get infected. And then repeated shaving on top of it, like next after a month or whatever, if there is a small acne, then again it'll spread in that area. It can cause, we see conditions where we see big cysts also and abscess.
Right.
And it spreads in the pubic area also. The pubic area is so that the infection can easily spread there. So we see all these conditions. So we tell them that please don't do all that. So if you really don't like that hair, then come for laser hair reduction, where we can reduce the hair follicles with laser. It is not completely removed. We just reduce the number of hair follicles with laser. You still have a little bit if you wish to. So knowing about the body, knowing what you want and what you don't want, taking the right choice is very important.
Any home remedy for this?
Home remedy for hair removal? Yeah. No. I think
not everybody prefers to come to the hospital for this.
Yes. There won't be any. That's an intimate area. So we can't just use any products, or sometimes people just hardly scrub it.
Yeah.
All that is very dangerous, and it can cause more damage than required. So obviously, intimate area is never supposed to be fiddled with. The pH of that area, everything is supposed to be maintained. That area is supposed to be self-maintained. Vagina is a self-cleansing organ. Even outside area is supposed to be maintained like that.
There's also something called urinary tract infections, UTIs, right? So there is one viral reel going on that if you have cranberry juice regularly, it will treat UTIs. Is it true?
So not cranberry juice per se, but actually they say cranberries are good and they maintain little health of the epithelial tissue.
Okay.
So related to that, there are some products also which have cranberry probiotics all together. It's like a healthy capsule what they take.
Achha.
But people don't realize that when they go for cranberry juices, they take preservative juices, and it is sweetened also. So when they take all those juices on a routine basis, they are going in a line for diabetes. So they are not treating any issue. And once there is urine infection, no matter what we do, we have to find out what that infection is, what is that bacteria. Then first take antibiotic. Then preventing the infection is what they have to take care. For preventing of infection, we have to give them proper hygiene of intimate area, and tell them all that intimate area health and hygiene, and finally go for it. But cranberry juices per se, we tell them have dried cranberries. That's good for overall health also. Unsweetened dried cranberries, just a fistful.
Right.
Yes.
So raw cranberries are
yes.
I'm like talking about hygiene, like hygiene in the intimate areas, like people are using various products that are available in the market. Now, is it better to go for them, or is there any solution per se? Because I've also heard some cases or seen as part of the research, there are some people who suffered burns or severe, distress situations. So how do we deal with this? And also in the market, there are some products available like V-Wash, etc., etc.
So the whole concept is that that area, the vagina and the outside vagina, it's supposed to have an acidic pH. So if it has an acidic pH, because vagina is directly open to outside environment. So if it has acidic pH, it's supposed to protect itself from outside bacteria. The moment it gets alkaline, it's most easy for the infections to come and get infected. So that is why to maintain an acidic pH is what the market is suggesting. The V-Wash and other washes and all are only to maintain a acidic pH for the outside area. So now outside area, cleaning with just water doesn't make sense.
Right.
So because as we are having bath on a routine basis also, we are using some body washes, but these body washes are more of alkaline nature, and we want a different pH for the intimate area. So that is why all these products have come. So it's fine to use the product, but you have to make sure it's only for external use, not to go inside the labia and only once a day. Sometimes I know some people who have been using it every time they use the restroom.
Okay.
All that is very bad. So we have to use it just once a day for external use, and that too with cold water.
Some people think it is, people who have OCD, like they think that they're maintaining extreme hygiene.
Some people use Dettol also.
Yes.
We have to tell them that whole body has bacteria covered for us. It's just not visible. So these are all good bacteria, probiotics like that, So we keep taking also the curd what we take, and all these are probiotics. So if we have good bacteria in the body, it will protect us from harmful bacteria. So even the intimate area, it maintains its pH. It has some bacteria to protect itself. So if we are using Dettol and all on a routine basis, it will kill the external bacteria, the protecting bacteria. Then outside things will come.
Another, thing that is going on social media with filtered Instagram stories or Korean dramas, and also, OTT platforms like Netflix, Amazon Prime, etc. We see that people want, a beauty standard has been set. Secret beauty standard has been set when it comes to intimate parts also. So, you specialize in cosmetic gynecology, right? So what is the line like, when should people go for cosmetic gynecology? Is it only for this beauty standard or some kind of peer pressure, or are there any genuine cases per se medically?
So
where do you draw the line per se?
So generally when it comes to cosmetic gynecology or when it comes to plastic surgery,
many people don't know what is cosmetic gynecology.
Yeah.
So if you could give us a brief on that.
So it's not just like cosmetic gynecology. Cosmetic means, as you said, it's more of beautifying. So it's not just cosmetic what I deal with.
Right.
So I deal with cosmetic, functional gynecology and sexual gynecology. So these are all the parts which I deal with. So I deal from adolescent health till menopause. So in this point of time, they can come to me with anything related to cosmetic issues like maybe pigmentation. Sometimes PCOS clients, they have hormonal imbalance. So that is when they have pigmentation around their neck or other body parts, even intimate area, underarms. They'll have more pigmentation because of insulin resistance, their innate condition. So they can go to dermatologist also, but when PCOS clients go to a dermatologist, they will club with a gynecologist and then take it forward. Because they want the hormonal conditions to be corrected. So like this, clients can come for something related to pigmentation, or sometimes their intimate parts like labia, plasty, they don't like their labia. So I had a client where a mother brought her baby also, saying that baby, it's not like a baby, it's a child who is just about to get married, saying her labia is, she's not confident. Why don't we, I have Googled about it, I have seen, so she wants a labia plasty. Like
sometimes
that a mother.
They're deeply insecure, like, it's not asymmetric or something.
So it is very important for the women to feel confident in her body. So as long as she's confident, she can, once the woman is more confident in her body, she is more confident in the relationship, or just like, inside out confidence sort of a thing. So if it is something like a labia plasty, and sometimes it's not just about the look of it. Sometimes when they come for a labia plasty, it's so much of hypertrophy that they have other issues like irritation, functional issues like irritation and repeated infections because it's sticking to each other, or they are not, if they are athletes or something, like they are not confident enough to wear, those garments and perform, and such other things also will be there. So we deal with these things, or we deal with even laxity post-delivery. If they have a lot of laxity, we do a vaginoplasty. All these come under cosmetic. And when it comes to functional, this vaginal laxity or any urine leakage issue or any hormonal thing post-menopausal. So we deal with all these, and sexual medicine comes like vaginismus or related to sexual health and all that. So it's a wide, big umbrella what we take care of from adolescent till menopause. Lot of things where people don't know, but then we are there waiting for them.
Right. Many a times people do not have the awareness, they might be undergoing this condition, but they don't know where to approach, whom to approach, where to go. That's where the problem comes in. And ma'am, like having understood what are the areas that you cover, like you mentioned about labiaplasty. What exactly is the treatment for that?
So labia are something like a lips of vagina. Vaginal opening is covered by labia. So when it is too much of hypertrophy, either related to hormone or congenital from birth or a little later on because of pregnancy hormones, it hypertrophies or anything, any reason if they are not comfortable, we do a labiaplasty. Labiaplasty is correcting the shape of the labia. So when we do that, they attain a good shape so that even the woman is confident and she can just have it.
So like also there are some, as you mentioned, laxity and dryness. So there are some non-surgical procedures. How effective are they?
So when it comes to non-surgical procedures, so we have to see which works, which doesn't works. And the beauty of it is right now we are having a lot of options. Priorly, we hardly had any options. So right now we have vaginal lasers, or for urine leakage, we have a magnetic chair called Emsella chair, which nicely strengthens their muscles also. So
in India, are they using Emsella, ma'am?
Yes, I have it in my own clinic.
Okay.
So I have a chair. So.
Many people don't know about it.
Yeah. But now, because we are talking openly, so these are all so much of intimate things and hardly spoken about and all that. So now as doctors, we are talking more about it openly, and we are telling. That is when people are at least knowing. And now people have started to browse also online. Like they see everything what it is. At least if they don't know the terminology, something they'll be browsing and they'll finally get to know. Like vaginismus, many people told me I didn't know there is a term called vaginismus. I have this issue, but I haven't seen it online. So slowly they browse and finally they come to it. Then they see, sometimes they go somewhere else, then they go somewhere else. Finally they have to navigate and come. But these topics are such topics that there is no clear picture unless and until a doctor themselves they talk about it.
Ma'am, recently I was going through one blog on Reddit, right? Over there was a discussion. There was a young couple. That couple married after a lot of struggle, in the sense like it was a love marriage. So it was a long association of love. They got married. But they had to go to the doctor for the reason that they were unable to consummate the marriage. Though they were, liking to get intimate with each other, whenever they were trying to do so, there was severe pain. So what is this condition?
So medically, this condition is called vaginismus.
Okay.
So vaginismus, this is a condition where a couple comes to a clinic saying, "Doc, we are not able to consummate the marriage."
Right.
And it's not just that the couple is just, they are freshly married and maybe I see them. Sometimes I see the couple in just 15 days of their married life.
Okay.
Sometimes I also see couples who are 9 years down their married life.
Yes.
But the basic thing is I'm not able to consummate the marriage.
Right.
Or they sometimes say that they sometimes even push or avoid intercourse just because the fear of consummation of marriage, they have this thing in their mind that it is painful.
Okay.
Maybe because of their personal experience, or maybe they heard it from somewhere, or maybe sometimes there is case of some child abuse, so it's just stuck in their mind, or some other news, some friend told like that, all that. So they build up stories and they have that lot of fear in their mind.
Okay.
But when they come to a gynecologist saying that I am not able to consummate, it's my duty to first see, is there any physical obstruction, or is it just the fear part? So I am supposed to tell if it is primary vaginismus, secondary vaginismus.
Okay.
So primary is till now they are not able to do. Secondary vaginismus is they have been intimate before,
Okay.
and after the delivery or something because of pain, again they are not able to do.
Okay.
So there is primary and secondary also to it. So in these conditions,
But is it psychological or a physical condition, ma'am?
both might be there also.
Okay.
But when they come to us, they don't know what it is. So some people, there'll be a tight hymen which they are not able to break. So they don't know. So then they come to us. But still, because they have a tight hymen and they have tried for intercourse and it was very painful and they don't know what to do. So these intimate matters, the most of the time is like they don't know what to do. They don't know whom to tell. They don't know if it's normal or if it's abnormal. So they waste a lot of time.
Like you said, 9 years, they didn't even address that issue.
Yeah. And so when they waste so much time, obviously they'll build in fear. So there is one obstacle. They can't move it. So again, Mali, the fear keeps increasing.
Right.
So it just builds up over a time. So now I am dealing with the problem and fear also. Or sometimes it's just fear.
Okay.
So both the elements might be there. And this condition actually priorly, I hardly saw any case prior in my practice when I was dealing with everything obstetric.
Initially, yes.
Initially. But later on, when I completely exclusively, I'm seeing only these cosmetic, functional or sexual medical problems. Now I have so many vaginismus clients. Almost daily I see one of a patient coming in. And they take a lot of time for the consultation also because they have fear element. I have to convince them it's okay, I will see. Then a lot of counseling, then slowly assessment. And it goes on.
So now it's a common phenomena amongst Indian marriages. How effective is the treatment for this? What kind of treatment they have to undergo?
So again, this depends on when they meet the doctor. Suppose it's a new case, like they are freshly into marriage and they have come and they are seeing me just 15 days through. Then it's easy to tackle their fear also. And for me, and I'll give them some training exercises and all that. It's easy to crack it. But it's a group effort. So there will be counseling involved, there will be physical exercises involved, then they will see me. If needed, we will do examination also under anesthesia sort of a thing. Okay. So if it is a recent phenomena which they have been experiencing and they immediately come to us, then it's easy to crack. But it's been long standing, like 9 years. So it's very difficult to break such fear. And in such conditions, we even see that the couple is no more interested in each other or they are moving apart or something like other elements are also there because it's been a long standing relationship which is not going forward. Yeah.
Sometimes it can also lead to divorces, etc.
Yes, and some couples will be like, okay, now I have vaginismus, but for the society's sake, let me have a child. You know, not wanting to go and finish off the vaginismus issue. So I have to convince them also that, see, if you want to have a child, then IVF is enough. But as such, after that, you'll be even more busy in taking care of your kid and later on career and all. So tackling this problem will again, it'll be like a shelved issue. Once it is shelved, because there should be that intimacy between the couple for a long-standing relationship, or else it doesn't work out.
And ma'am, like what is the most damaging thing a partner can say in this situation that you have heard?
Damaging for the couple?
Yeah.
So both of them should be understanding. See, I have seen lot of issues like after 5 minutes of pacifying the client. First of all, when the client comes, she's so terrified to talk to me. First, what they do, they take a consultation, then they cancel it, they postpone it, again they cancel it. So this keeps happening. So the moment I know that they have been pushing, I'll have a hint that maybe it's a vaginismus case. So the moment they come, first they'll be silent for some time or they'll think where to start from because it's difficult even for them to open up.
Right.
So that is why we first ask some basic questions like routine gynec stuff so that they first open up and then, you know, we can move forward. Then sometimes the husband will start talking before the wife can open up because he wants to say, because maybe it's their mutual understanding. And we have also seen the women breaking down, like she'll just pour down and then she goes through a lot of emotional outburst in my clinic also. But if the husband is not cooperative enough and if he is like demotivating or little bit of, I'm not satisfied sort of a thing, then woman is even more crippled from inside because all these are little bedroom issues. They are little emotionally attached.
Yes.
Yeah.
So they also need some kind of counseling.
Counseling is, it's the important thing in vaginismus cases. So vaginismus, my consultations are almost like an hour or 2 hours also. Because counseling itself, talking to them, finding out what is the core issue, till where have they come through, is this the first doctor they are meeting or they have seen like so many other doctors, because everyone, if they by chance go with an old timer, So they might just say, the old timer might just say, listen, that's all normal, just go home and do, everything is fine.
Right.
And they are not able to tell anyone else because they have already visited a doctor. Someone said nothing. So it's a lot of thing going in their mind also. So they have to come to the right person, go in the right path to finally find a solution.
To prevent smell, people also use some scented products.
Yes. So there is a natural smell for vagina which keeps changing. During menstruation, it will become little metallic smell.
Okay.
So this keeps changing throughout the menstrual, the cycle, what we say 28 days cycle. But this is a natural odor of the intimate parts. So that thing should be there. If we are using external perfumes for this intimate area, it causes lot of rash, and vaginal infections is what we see. Vaginitis is what we call for vaginal infections, or outside area infections. It causes skin irritation, redness, inflammation, finally leading to infection. And obviously they keep using undergarments, so it keeps rubbing on that area. It just becomes more and more, and using wet undergarments, moist ones, and all that will just trigger fungal infections.
Right. Any specific case that you remember? Because we have discussed several issues, like any specific case where due to the use of this do-it-yourself methods or any kind of chemical products, the situation went out of control, out of hand?
So it's not because of use it yourself or more of unaware. This razor case is what we see more frequently. They keep shaving that intimate area and they already have a folliculitis.
Okay.
That's a folliculitis is one hair follicle getting inflamed and then finally leading to little pus. And then when they do, they cut it and that will spread and little bit will become more or just spread the entire area. Entire that mons pubis is what we say, that part. So where the pubic hair is there. So that entire area is highly inflamed and they are not able to walk. That's how in that state they come to my clinic saying, I'm just not able to walk, I have fever, it's just throbbing, and then we have to give them a high dose of antibiotics to just get that to normal level. Because in the huge area, we can't do anything. The infection just spreads further and further. And it's not just that. You will also see vaginal infections. We'll see urine infections. It's just multiple infections repeating every 1 or 2 months.
Yeah, moving on, ma'am. Like there are some women who have a condition, right? The sensitivity and the pleasure factor has significantly reduced, sometimes due to age or sometimes after childbirth. We see this issue. But recently, I have seen that there is something called as O short and G short. Like usually this PRP is something, I have heard like when cricketers have some injury, that is used. Now here, to increase sensitivity or for that so-called term called orgasm, people are going for these treatments. What exactly are these treatments and are they effective?
So what we say is that PRP, it's platelet-rich plasma, is what we extract from patient's own blood.
Achha.
So if the patient is young, they have good PRPs. And what they do, so in sports people, when they inject this PRP wherever they are injured to the place, it's supposed to, if the healing process, it's supposed to enhance the healing process, like fasten the healing process, so they are healed better. So the same way, when it comes to pleasure points or whatever, we say when it comes to orgasm, there is a short orgasm, clitoral orgasm. There is a long orgasm, which is a vaginal orgasm. So when it comes to these, as you are saying, maybe with age or after childbirth or gradually people do come. So we
also anatomical issues also could be there. No?
Anatomical issues might be there, but then this PRP won't help in those cases. Okay. This can only help when they were previously fine. The part is all completely fine, and then naturally they are having that less of orgasm compared to previously.
Achha.
Not because of any anatomical issue here per se. So when they come like that, and they clearly tell, and what we have noticed is sexual health is so important, and of late many people are realizing that also, that as they are maintaining the sexual health, their whole emotional health, everything, physical health is also being maintained. So nowadays people are coming and asking and talking to us regarding all these issues. So when they come to us, one thing what we can do is the PRP shots, what we do for the either clitoral area, that is the short orgasm, or the G-spot is what we call for the vaginal area. So what it is supposed to do is these platelet-rich plasma, they are supposed to trigger a nice inflammatory response and cause rejuvenation of the nerves there. So as we are aging, even the nerves also get tired and they take time. So this PRP is supposed to enhance the nervous stimulation also. So we have a case studies also for O shots what we do. So lot of our clients are happy with the O shots what we do.
That is for the short or?
Yes, the PRP shots what we do for the clitoris. When it comes to vaginal orgasm, that is where they are supposed to tell us. That's again a thing where half the people don't know where it is. Like the women basically, they don't know where the orgasm points are. Most of them they don't know. Only few people know. So regarding, they come and talk to us, they tell, and then during the examination, talking, all that, we figure it out and then we go for the procedure.
Okay. What is this G-shot, ma'am?
So it is, it's basically G-spot area. It's not a G shot. It's a G-spot area that is there on the anterior surface of the vagina, wherein it is supposed to cause orgasm for the female.
Okay.
It's a long orgasm, what we say. So, but half the people, they don't know that spot. We can, many ladies, they do palpate their anterior vagina and they try to find that spot. It is little more sensitive spot, what they say. So they can figure out their thing, or else they come for examination also and they ask us, can you also help us how to figure out? So that is where we also can give PRP, or we can give other boosters to enhance the spot.
So in your clinic, ma'am, like what age group of patients come for these kind of treatments?
So we have lot of age groups. It's not of not just this age group. We can't name it like that. So from 20, I also have a 45-year-old patient who is wanting to take the shots. So that's basically in my clinic. I am the we don't. I know what is the importance of sexual health. I know what is the importance of how their intimate area should be, they should take care of it, and how their pelvic floor muscles should be fine so that they don't have any urine leakage and all these. I know the importance of women body. So that is why we do talk more about it, so that people first they come and discuss with me. See, I am facing this issue as a couple. I am not sensing anything. So doctor, can you help me? So that is when we walk through her entire condition, see what she requires, and finally prescribe her the treatment. Let it be loose vagina, let it be relaxed pelvic floor, let it be orgasm shots, or let it be any other condition.
Okay.
So all these come under that umbrella of sexual health. We do it with everything.
So when you give treatment for it, does it last forever, or it's a temporary phenomenon?
So nothing of these will last forever. All these are recurrent things. So even if we give an O shot, we tell them it lasts for 6 months to 9 months.
Okay.
Because the nerves have to keep regenerating and all that. So after that, if they have a good, after the O shot, if they like it, they do come back after 6 to 9 months saying, hey doc, I want to repeat PRP injections. So like that, we have clients who are coming back again and again. And when it comes to pelvic floor muscle strengthening, like the MCELA chair, what we do also, it's like doing intense gym and strengthening your pelvic floor.
Okay.
So when we do that, obviously it has a time with which it acts. So after, they do a nice gym for some time and then they stop it. There is muscle wasting which happens annually every year, and post-menopausal women, it's enhanced. It's doubled that muscle wasting. So that's why we also tell post-menopausal women to do muscle strengthening exercises, not just cardio, not just walking. Do muscle strengthening so that these muscles will support your bones.
Right.
That's how muscle strength, and you have muscle wasting happening every year, so that it will also deteriorate a little, cut down that muscle wasting and all that. So all this protein diet and muscle strengthening, all that we tell them on a routine basis.
Ma'am, though it might be a sensitive topic to discuss upon, like many women, like now that we've spoken about O shot and G shot, etc., many women do not know what is an orgasm. They don't, there are also reports which say that they fail to realize or recognize their own bodily needs. So as a gynecologist, what is the suggestion or what is the awareness that you would like to give them?
So,
some people also go through that mental trauma or psychological trauma.
Actually, we have some couple also. They'll come and tell us also that I am getting, I want my husband to feel satisfied with me, or else, I'm scared where, he'll have some extramarital affair or something like that. So it's not, I mean, if someone wants to have an extramarital affair, no matter what they do, they will have. It's about the mindset. I'm not here to, do a mindset training. But then we do talk to the couple. But the couple themselves, they'll come and tell us that, we are looking at this vaginal laxity. If it's a loose vagina, they can't feel anything, obviously. The vagina should be a little on a tighter side for them also to feel something. So when they come and talk to us about it, both the wife and the husband or just the partner, so that is when we know. And we also tell the women, it's randomly to everyone. It's important to know their body. And only if they sexual intimacy is something which both the partners should enjoy, and that is why, I mean, that's more important for even emotional health, mental health, and overall dealing with stress also. There are studies which say that people who are sexually active for a longer period of time, they live longer also. Longevity also increases, there are studies which say that. So that's why it's very important to know their body. So
usually there's a taboo in Indian society, they do not discuss about it, and they're also clueless on whom to speak about these issues.
That's
like
why
that years together they silently suffer.
That's why nowadays, I mean, now awareness has been increasing. So mothers are getting adolescent girls for menarche, discuss about menarche with the doctors, gynecologists. Menarche is when they attain first period, so that they can talk, and then they'll have someone in their life to talk to about these matters. When mother will introduce her daughter to a doctor, then she will have the doctor, but then the connection should be there. So like that, we have girls who are coming before marriage also to ask us how it is, what's it going to be and all that, when they can't discuss it with their own family members and all that. So but now awareness is slowly increasing. First of all, they have internet, they are browsing everything. They know better than before. It was like that. And many people are trying to explore their own body, which is absolutely fine if they go in a proper way.
Yes. Like just now you were mentioning about pelvic floor issues, etc. There could be a person working in a software company. Many a times it happens that the washroom is untidy or unhygienic. So like they have back-to-back meetings in corporate offices, and that person is not going to the washroom for hours together, like urine holding. So what impact does it have on the bladder muscle and pelvic floor?
This is a very common thing also. And
even during travel.
Travel, so they won't drink water. Yes. They are scared to use, and that too elderly women, they actually suffer more than youngsters. So elderly women, they have other issues also, so they can't get out and go and get up and go and all that. So firstly, dehydrating is a very bad thing. I mean, they don't drink water because avoiding the bathroom, and so they are dehydrating the body on a routine basis, which is a bad thing. Hydration is very important for all the tissues. And second thing, if young girls are holding their urine for a lot of time, there'll be a lot of fatigue for the muscle. Muscle will get tired. Obviously, it's stretched for a long period of time. The contraction and relaxation of the muscles are should happen on a routine basis. So 3 to 4 hours is fine. But more than that, if they are not drinking water, bladder is not full, that's a different story. But if they're drinking water, if the bladder is full, they are having sensation, they are trying to hold it for a long period of time, that will lead to muscle fatigue. Finally, the nerves also will get fatigue after, a prolonged usage and all that. Prolongedly doing the same thing for a long period of time. So right now, the toilet hygiene has become, it got its importance right now. So even there are a lot of other products also, what we say. There are some companies which give them, stand and pee products, or you have sanitary wipes for the Western commodes, or you have the cover sheets, what it is there. So I tell my clients, if you're traveling, that's when they come. Some people have urine infections. So when they're traveling, they're more anxious. So they come to me saying, I'm traveling now, what to do? So I suggest them some products, but I tell them, you please hydrate properly, because again, dehydration will again lead to infections. So hydrate properly and do your thing. But right now, even the quality of India is improving. The standards are improving. So it's no more that bad. But then we can manage with these products.
There are many times like work they're busy
Yeah.
with their work, held up with their work, or sometimes
Yes.
lazy. So that also they hold, right? But this is going to have a long-term impact on the muscle health.
100% it will have an impact, and that too, sitting on one place and doing so much work is as such bad. We advise them, every half an hour get up, drink a half glass of water, once in every 2-3 hours, use the restroom, come back, feel fresh. Obviously mood is also important. So it's not just about one part. I think it's about the overall body also, what mind and body, all coordination should be there. So we have a lot of software people only coming with PCOS because it's a desk job, obviously. There no physical activity involved, and lot of food is readily available in the cafeteria. They easy
Binge
access,
eating also.
easy access. And then by the time they have these night shifts, so their sleeping pattern is disturbed, their hormonal imbalance, finally they come. So we tell them, this you might be doing it, you can't do it for long time. If you take this for long time, your health will deteriorate and you'll stop it. So might as well, either balance it or you give more priority to your health.
Right. Now, many girls during their growing up stage, they might undergo severe pain, due to the menarche or the menstrual cycle. And they're told that this is normal, after a few years, it will get sorted. Or sometimes people in our households, they say that like when you get married, things will get sorted. So when is this pain considered to be normal? And when should people be cautious that it requires medical intervention?
I think pain at any point of time is not normal. So let it be mild pain, moderate pain, severe pain. Any pain happening on a routine basis, it's not normal. So someone is having pain, the first thing they should do is first go and meet a doctor. First know what is that pain, what do you have that it's causing pain. If everything is normal, then that's a different story. Then we have to think what to do. Maybe change the diet, make the period more friendly, because many people have lot of sugar. So it's inflammation in the body. Sugar is directly proportional to inflammation, redness in the body. That will lead to more pain. Or some food they are not suitable, like some dietary food. Some people they are not meant to be for dietary thing or gluten like that. The moment they change their diet, the inflammation reduces and there is less pain. So these are food related or diet related changes they have to make. Some people, very young girls, they have pain. What we say is if there is little, the blood loss, it's negotiated through a tight opening. So when the blood is passing through the tight opening, then they are supposed to have the pain because it has to push through it and all that. But that happens when they have more bleeding. They have more bleeding, it formed a clot. Now clot is trying to negotiate, not just the normal flow. Then we have to see why there is heavy bleeding. So like that we have to see, is it heavy bleeding causing pain, or is it something like endometriosis causing pain?
What is endometriosis?
So endometrium is the lining of the inner lining of the uterus. It lines the endometrial cavity. So this endometrium, if it is present in its normal location, it's just fine. But sometimes this tissue can be there outside in the body, like in the POD is what we say, or on the ovary. It can be elsewhere in the body. So if it is there elsewhere, then this endometrium tissue, because it's reacting to hormones, so it will react to hormone at the time of menstruation, it will hurt more. Because it's reacting to hormone, and the normal endometrium is shedding, but this is not shedding, it's elsewhere, it's stuck there. So it's high inflammation. Endometriosis is an inflammatory condition. So in that also we are supposed to reduce the inflammation. So that's how it works. And it's only a progressive disease. It only keeps increasing. It never reduces unless and until we take some aggressive steps. And other conditions also. Sometimes people might have pain when they have some fibroids, polyps. There are other conditions. So first we have to see, is it any pathological condition? Is it something like heavy periods or something like this? Is it because of dietary inflammation caused hormonal imbalance and finally inflammation? And so we have to figure out what is it and then act accordingly. Sometimes we just give them, everything is ruled out, then we just give them magnesium supplements to relax the uterus. We tell them during that time, please don't have high inflammatory food. Like in the movies they show, they just keep binging ice creams or sweets and all, high inflammation. So don't do that. Little bit of dark chocolate is fine. So they change their lifestyle and all, it can be done, most of it. But pain any point of time to anyone, it's not normal.
Like, does it also happen, aggravate due to stress, like exam stress, job stress, etc., or during breakup situations?
Anything is so when the body is going through a lot, let it be any condition. When body is going through a lot of stress, it's an inflammatory condition as such. Again, it's triggered, and that's because even the hormones like cortisol and all, they are released. They again increase sugar levels in the body. So any stress condition leads to lot of inflammation, and they'll have irregular cycles, and they might be associated with pain, or sometimes they just push the period for some temple visits or something like that. That time also, because they have been pushing the periods because of hormone, finally withdrawal thing will be little painful more than before.
Like this pushing the period, they use some tablets, right? Is it advisable to take those?
So as a gynaec, obviously I won't recommend it at all, because gynaecs like regular cycles.
Right.
So when you have regular cycles, you are monitoring it. So your health is fine. So for a woman, having regular normal cycles is very important. That shows her health status.
Okay.
So pushing it doesn't make any sense. And as such, I personally don't believe in those things. In olden days, they used to have bath in a river or something like that. They have to go outside, and they didn't have such sanitary napkins, such good system they didn't have previously. So to cut down, they must have put some restrictions and all that. Right now, we have a lot evolved from those days. So right now, I personally don't take it so much seriously, but obviously for important events like marriage or going to temple visits and all, people do push. And in fact, once they'll come to us, they'll see the medication. Next time they just do it by themselves. But you have to take it correctly.
Right.
You can't take it at any point of time very close to the periods. It's no point taking it.
Okay. But these capsules also should be taken under guidance.
Any medication is under guidance.
But many times, as you said, people come once and they later on they do it by themselves. That's a problem actually.
Yes.
And also, ma'am, irregular period cycles. Why do these happen? Many people suffer because of that.
Yeah. So any irregular, so it's all a hormonal play, as I said. So we have a nice FSH, LH hormonal play. So a 28 days of cycle is divided into two halves, 14 days and 14 days. In between happens ovulation, egg release.
Okay.
So first half is one hormone, second half is another hormone. So anything which will disturb the hormonal play, they'll have irregular cycles.
Okay.
So the most common cause is lifestyle, not having a proper lifestyle. So for many conditions, like let it be PCOS, anything, first and foremost thing what we say is lifestyle modification. Check your diet. Have a proper limited diet, not too much of junk food, not too much of sugars, have a balanced meal, sleep on time, eat on time, stay well hydrated, do a normal exercise. Exercise causes insulin sensitization also, blood supply will all be better. So first do this, along with this take medication, because after a point of time, okay, you'll take medication for 6 months, 1 year, 1.5 years. Finally, when they stop, it should go back to normal. That can only happen with lifestyle changes. So that's very important thing which people miss. They'll be like, now doctor, you do something. It's very difficult for us to do everything. Yeah.
Any peculiar cases that you have come across?
PCOS is like, obviously any gynecologist can give you some zillions of patients. There are some nice patients, who follow the instructions. So when we give them medication also, they do proper exercise, they do dietary changes, everything, and they take control. So once they are PCOS, they are PCOS forever.
Okay.
So it can only be kept under check. So the moment again their lifestyle changes or they get some stress factor into their life, again periods can get irregular. And it will nicely show also. First it's little bit, instead of 28 days period, it might be 40 days, then slowly 2 months, then it will become 3 months, and then it won't come. So it will give nice hints also where they have to pick it up and then go. But some patients, if I tell now, after 3 months, they'll come back again to me and say, doctor, I didn't start. Now what should I do? Or I took it for 1 month and I stopped it. Or they took my medication, but they never did lifestyle modification.
Okay.
But only patients who take care of their health will actually
Many
improve.
people think I'm taking medication. Why should I bother about lifestyle? This is a
Easy.
lifestyle that I live.
Yeah, easy thing is that OC pills, what they take, 21-day tablets they take.
Right.
So of the moment they take 21-day tablets, you get your periods on 28th day. So like that they keep continuing. So whenever they stop it, their periods are again gone.
Right.
So that's just a symptomatic thing. So when you actually do the cause treatment, like you deal with insulin resistance and you deal with your lifestyle modification. So you take OC pills also if you want. Take it for 6 months, but in 6 months correct the cause and finally stop the pills so that you can take off in life. You know, the PCOS will be under check.
What are the hygiene protocols that females should follow during the menstrual cycle? Many people are confused today. You know, even there's a report stating that a lot of Google searches on what to use, whether we should go for a sanitary pad or a menstrual cup or something like a tampon, or in earlier times people used to use cloth. So what is an efficient way? There's lack of awareness even till date.
Yeah. So all these are different modes of, like how we say, different modes of transport. Like that, you have different options on plate. But I don't think anyone is using cloth anymore. It's obsolete. I think so. It's obsolete.
In rural areas and far-fetched areas.
We have Akshay Kumar's movie also. No?
Yes, Padman.
So a lot of awareness is there.
Yeah.
So even we are getting low-cost cotton pads. So they are moving on to cotton pads rather than using cloth, because how much ever they wash the cloth, there is a time for the cloth, and how much ever they think they are washing it properly or whatever, it's more scope for infection.
Right.
Not maybe in internal vaginal, even maybe external triggers might be there. When it comes to using a sanitary pad, it's perfectly fine. Only thing is you have to change it every 4 to 6 hourly.
Okay.
So you the people can't keep it for more time, like 12 hours or more than that, or I just say I forgot and all that.
The sanitary pad advertisements are showing 12-hour protection, 24-hour protection, etc.
Yeah. So it depends on how their flow is. That's what they are saying. So my pad soaks better. So it's giving you 12-hour protection. It's like that thing what they are trying to say, that it's soaking better. But if it's soaking better, that means they might be using more gel also, which is again not good. We are not suggesting again these microplastics and all. The pads will have all that. It's again not good for health. So go more for cotton stuff. When you go for more cotton stuff, it won't soak so well like a highly gel-based things.
Right.
Okay, but we are getting better and better at it. And but the bare minimum thing is they have to change every 6 hourly.
Okay.
Because the old blood will irritate the area. Now, obviously, they are wearing it for 6 hours. The first hour only, it must have stained. So that blood lasting for more than 6 hours there in that area, it will irritate the skin. And blood is a good medium for infections. If you leave blood anywhere, it attracts bacteria. It's more infective medium. So we have to eliminate that medium. That's how the intimate hygiene is. So, but these pads, again, they are a lot of burden on earth also. So that's why they are saying, see, every woman needs to use at least 2 pads for 5 days bare minimum every month. From age of 12 years to age of 50 years. Imagine how many pads per woman they are using. But menstrual cup, if they come to, nowadays we are getting silicone based menstrual cups.
Okay.
So this one cup can come for 10 years.
10 years?
10 years. It's what they say. So it's silicone material. It's inert to our body. It doesn't react with human body. Like breast implants are silicone.
Yes.
They don't react with human body. So they just they can keep the menstrual cup for 4 hours. After that, they need to empty it, wash it, and reinsert. And again store it. They have some sanitary things also, how to save the menstrual cup and all that. Again redo it next month. Like that, they can keep that same cup for 10 years if they want to, if they are keeping it well. Okay, so look at the burden. It's coming down, like no menstrual pads, so the burden on earth is less. So that's why many people consciously are moving to menstrual cup if they can, who are not scared. So tampon is again same thing like pads. They have to change every 4 hourly, maximum 6 hourly, more than. And if they don't change the tampons, they get one serious infection also.
Okay.
So it's very important. Sometimes they forget. It's inside the vagina. They might scope for forget. So tampons is very infective if they forget.
Okay.
At least silicone cup is inert material. It's their own blood. So they have to keep changing or else it leak obviously. But yeah, you are not supposed to forget. And when it comes to just perineal hygiene, we just tell them wash your area morning, evening, whenever you can, with just some lukewarm to cold water. Cold water is good for the skin. The more hot water they use, the more dry the skin gets.
Acha.
More dryness, more irritation, more redness, more infection. So we say use cold to lukewarm water. Use if you want, use intimate washes. No need to use Dettol. So like that, routine hygiene.
Now that you're saying about 4 hours, it has to be changed. There could be women who are working, or women like senior police officers or young police officers, or any challenging situations, or some sportswoman. Now, in that situation, it becomes very difficult, to bother about the time, and there could be some circumstances, in some remote areas or some difficult terrain you are. In that situation, how should they tackle this challenge?
That is why they say women are great. Because they handle so many things.
Absolutely.
So not just some women in some situation. Like if you just take me also. So when I travel, obviously I'll carry an extra thing in my bag. I will make sure the moment I enter, I'll make sure where is a restroom. All these things go back like undercurrent in our head.
True.
So they just figure out with their time how they do. That's why they say that women are great. If not 4, they can wait for 6. But depends on their flows. Think it's heavy bleeding.
Right.
So that's why it's better for them to just take a little on a lower workload on first 2 days. But not everyone can do it. Like
As
even
you said,
I
for
can't do it.
doctors also, like let's say you're in the midst of a surgery.
We can't do it.
At that time you have to.
In the middle of the surgeries, we get the periods also where you have to de-glove and run and then come back. That'll also be there. So you can't help it, or else priorly only you should be well prepared.
Right.
Yeah. So all these are part and parcel of life, and nothing is disgusting. It's everything is fine. Yeah.
That's quite phenomenal. Tackling these challenges on a day-to-day scale.
Yeah.
Ma'am, like in recent times, most of the elders, they say that PCOS, infertility, and the sexual problems are a recent phenomena. Especially in the past 10 to 20 years, they have grown because of the faulty lifestyle. So according to your experience, how important is it to have a proper lifestyle to rectify all these issues? And because of, neglecting lifestyle issues, what are the challenges that people are facing? Let it be women or young couples or anybody that comes up to you. What are the challenges? Any peculiar cases that you can share with us?
So as you are saying, lifestyle is damn important. We are only seeing the shift in all the diseases, right? So PCOS is increasing and infertility is increasing. When you ask me about some cases, so we have some nice young couples also who are less than 30. They come to our clinic and they say, we just got married. But nowadays marriage is also on a later note. They are getting married at 30 or a little later, whenever they are ready. But after that they are like, I need some more time for myself. See, I want at least 2 years. Now my career is at peak. We just got married at 31. Then how am I supposed to react to it? So I have 2 caps. One is my doctor cap, one is my woman cap. So as a doctor, it's very advisable for a woman to conceive before she's 30, because that's when she's very fertile. After that, little fertility rates keep decreasing. After 35, it's even more. Until and unless their lifestyle is very good and they are having regular cycles, everything is tip top. So as a woman, when she comes and says at 31 I'm just married, I want 2 years gap, I can understand that she's newly married, she wants to know her family, she wants a career to take off and all that. So our advices will be very much using both the things. So we do tell them, okay, you can push it, okay, but then you make sure your lifestyle is fine, so that with lifestyle you're trying to get some 2 years extra for yourself. So before that, we'll advise them some tests any which ways, because we are doctors now, you have to do it. So we'll advise some tests just to tell her that here is where you're standing. So now you have your options. Now your option is do a proper lifestyle, wait for 2 years and then conceive. Then after 2 years, if she has any issue, then she has to decide as per it what to do. Some people are also considering freezing their eggs and all that.
Mrunal Thakur also, Bollywood actress and Tollywood actress, Mrunal Thakur, she said that she's considering freezing her eggs because she wants to focus more on her career and work. There was also an Oxford embryologist who also mentioned the real cost of freezing eggs, and that video went viral. Now coming to egg freezing, ma'am, like what is the cost of it, and what is is there a need for egg freezing?
So it's again, now as we are moving forward in life, now women are obviously doing equal things compared to men. It's not like they are also wanting to go excel in their life. Now no more like just getting married early. So it's up to their own what they want to do. I mean their choices matter. I mean it's having a little weightage.
Right.
So when they want to take a good decision in lives, so there are different platforms. I can't say. Some women want to concentrate more on their family and have kids on time and all that. Some women want to concentrate more on their career. Some women want to balance it well also. So when it comes to balancing, it's like they will take a step back to have kids and then again move forward in their career. That's how it's balancing. But some women don't want to compromise also. They want to have babies when they want to have. And I think we need to appreciate every mindset. I am no one to judge who wants what, and it's their life. Finally, they are living it. I am not living their lifestyle. So people who want to have it later in life, obviously it's like when a woman is born, suppose think she is born with so many number of eggs. Okay. This is a fixed number and it only keeps depleting through her age. And finally, once the eggs are done, like the body is done with the eggs, you attain menopause.
Right.
So as we are aging, so the first few years are first comers, toppers. So the eggs are highly fertile. I mean, the quality and quantity is good.
Right.
So as we are moving forward, the quality decreases. The quantity might be fine. I mean, what we can see in the blood test is the quantity.
Right.
But the quality might decrease because these eggs have been 20 years of stress, 30 years of stress, 40 years of stress. The eggs are same. The life is having so much stress. So when it comes to that,
to say that, like, you know, having to freeze eggs by itself will not guarantee fertility.
So no, having to freeze egg at the right time. So when you freeze the eggs before you're 30, that means it's a good quality eggs.
Okay.
So the fertility rate is high. When they freeze the eggs, when they decide slowly, they think I will freeze my eggs, and they freeze the eggs at 35 to 40 years. That time the egg quality also decreases. So the embryo quality will decrease. So freezing the eggs before 30 is better because the quality is good.
Right.
Then they can decide whenever they want to. Some people, they freeze their embryos also. The wife and husband, they freeze their embryos. So it's completely their call what they want to do. And coming to the cost of it, it's not like a broad cost. This is India. No, everything is cheap in India. So I don't think it will cost much in India. Maybe just few. The procedure itself might take $1 lakh or 2. The procedure, because you have to inject hormones to the women, finally make sure the eggs are enough quantity, then do a procedure to collect the eggs and then freeze them.
Right.
So the freezing, they will tell per annum you need to pay so much. I think it will be in thousands. Freezing part will be in thousands, but the procedure might be 1 or same like IVF.
Okay.
You know, they are marketing also. I will do IVF in less than 1 lakh or
yes.
So it
50%
depends.
Off,
Yes, because number of centers have increased. No, so like that everyone is doing the marketing.
But people say the procedure is very painful for this egg freezing. Is it true?
So it is like normally on a monthly basis, suppose you think this much hormone is being released. But when it's an IVF, instead of 1 egg, we need how many ever eggs possible. So generally 1 egg from one side will be ovulated for every woman, like 1 egg this ovary, 1 egg this ovary. But for ovum pickup, you will do pickup only once. So obviously you'll make 10 eggs this side, 10 eggs that side, collect 20 eggs. So imagine how much hormones they are giving to her, so that the eggs, the ovaries are, the follicles are becoming such a big size. Only then we can take, because if the follicle is small, you can't take it aspirated. So it has to become good number of follicles and in good size for them to take the pickup. So that's why a lot of hormone load is there on that body. So obviously she will also feel much bloated. She has to take a break from work for that month.
Okay.
Yeah, she can't do working on that month because ovaries are also loaded. They are too big. So she has to rest herself. And after pickup, the pain as such, it's done under anesthesia. So pain part is little less because it's under anesthesia. It won't be too much of pain. But body is going through a lot of hormones in it. So it's going through a lot.
Quite a tedious procedure.
It is. But that's what the women is wanting to take for her future. So it's you weigh the risk, you weigh the benefits, then you take a call.
Right. So like what exactly is the age when the fertility starts to decline?
So if the fertility is 25 to 25% before 30 years of age, it will slowly decrease to 15% like that post 30. And by 35, it will come to 10%. 5 to 10%, and 40 it will become 1% because they are very close to menopause. Average Indian age for menopause is 48.
Okay.
Yeah.
What is this AMH test?
It's anti-Mullerian hormone. AMH is what we say. It will give us a rough estimate of how much egg storage is there in the body. So with age, obviously the number of eggs keeps decreasing. So it gives a quantitative number of eggs. That measure it will give for the patient, not the quality of eggs. So some people will have AMH is less, even the quality also will be less. Quality also will be less. So obviously if they go for IVF also, the quality of the embryo might all be less. Yeah.
Like let's say some woman has gone for egg freezing before 30. Now can they be 100% sure that they will have a fertile phase?
So again, it depends on what is the age of the mother when she is pregnant. What is the health of the mother when she's pregnant? So embryo might be good quality. Again, it's implanted into the mother. So mother's health is very much important. Suppose now she's just 25 or something, she did her egg freezing. Now she wants to get pregnant at the age of 40, 35 to 40. At that time, how is the health of the mother? Because diabetes, hypertension, all these are mother's body, maternity things also, right? So how fit is she is also very important. And obviously when it's not a natural pregnancy, so obviously you'll boost some hormones at that time for the take up of the embryo into her, to body to feel natural. You push it for some time. So is she in a position to take everything? All that is very important.
Because a lot of misconceptions, people just get knowledge or information half cooked. Right, that's what they think is the reality. There are several other parameters going by what you say. Egg freezing per se will not guarantee a baby. It might, but there are also several risks when it comes to your age factors, health related issues, hormones, and also your situation at that point of time, which nobody knows. Right. I'm talking about menopause. Many of the women in their late 30s or early 40s, they suffer with this issue, menopause. And many people don't know that these are the conditions that they are facing or circumstances that they are facing due to menopause. So what exactly is this menopause and how to tackle with it? We see most of the mothers or, people in their late 40s, they face the situation.
So the symptoms what they face is they get cranky. They are more emotional. Sometimes, there is an emotional outbreak, or they are more angry or upset. Even family also obviously suffers, because when the lady is a little upset, even the family suffers. But at the same time, even the lady feels bad that this is not what I want to say, but I couldn't control myself then. Or sometimes they'll just, they have sweating, they feel cold once, immediately hot, they'll again feel cold, there's temperature fluctuation, what's happening.
Hot flashes.
Hot flashes, that's what we say. So they have this, they'll have, when it comes to again body, slowly they'll have osteoporosis, the calcium level keeps decreasing, muscle wasting keeps happening with menopause, all these things also will be there. But when it comes to symptoms, the most irritating symptom is that hot flashes and mood swings. These are the most irritating symptoms what they come with. So we say menopause is, like I said, once the eggs are depleted, that's when the body slowly sets into menopause. Finally,
When does it usually happen? What is the time frame for that?
so it can happen differently with different people. Suppose
There's
one
no set
lineage.
standard or no set age for that.
So the age is average 48 years for Indian women, but that doesn't mean every woman will attain menopause at 48. Some people will have menopause at 55.
Okay.
Some people will have menopause at 45. So it keeps varying depending on when their family history, when their mother had their menopause, when the aunts had their menopause, or how is their lifestyle.
Okay, it's also to deal with genetics.
Yes.
Okay.
100%. Because the number of eggs, everything is also directly genetically done. Some people have a history of early menopause also. Premature ovarian failure is what we say.
Right.
Before 40, they attain menopause. So, but then the symptoms happen to be, they can come 10 years prior to menopause also. And they can last for 10 years post also. That's all a wide range of age. We call it perimenopausal age, pre and post perimenopausal age. So that's when they initially, so all these things are like, we have to grasp them when they come initially, and then we have to find a solution with the lifestyle also.
Okay.
So many of the issues, we tell them also, for many ladies, try yoga, try meditation, do dietary changes, These are the natural way. And it first starts with simple symptoms, and slowly the symptom becomes more. So when it starts slowly only, they start their lifestyle modification. They can enter it very well. And we give them lot of supplements like omega-3 fatty acids we give them. We'll give them some protein boost also. We'll give them some magnesium tablets to calm their nerves. So we'll check their vitamin B12 levels, D3 levels, calcium supplements. All these things will be there. But then on a routine basis, they'll also do lifestyle modification. Apart from this, if they want more help, that is when hormone replacement therapy will come.
And ma'am, like in this menopause phase, like what are your suggestions? How should women handle themselves?
It's easy to say than to handle it. That's what it is, because the woman facing it will know much better than we advising it to anyone. But then always they have to follow a routine protocol. So something, this is again what is lifestyle modification is what I mean. Getting up at proper time. Obviously, they'll also tell me I am not able to sleep. I'm having sleepless thing, and I'm having fatigue. Right. So they'll do some blood investigations. We try to rectify their condition. Some people are anemic also. So we will try to rectify, and we'll give them proper protocol. Do some walking every day. Go for nature walk, like something like walk in a park, not in a gym. Do some weights exercise, muscle strengthening, because again, the most common thing, what a postmenopausal thing, the most common, they fall and they fracture themselves. So if they don't want to do that, they have to maintain a good calcium level in their body, and they have to have good muscle strength so that they are more active also. So active women and all, they can deal better than a non-active, more sedentary lifestyle is what we won't suggest. And if they want to go for HRT also, it's better for active women.
Right.
Because again, when you take some hormones, it'll carry some risk. Everything carries risk. There is nothing which doesn't carry risk. So again, more active people can deal with it better. But thing is, you have to start early. Like at 40 years of age, you flag some condition, you take a call on it, and then you move forward. So by the time you attain menopause, you're already in control with it, and so you handle it better. Suddenly you neglect everything, you just have that spurts of issues, and finally full blown condition will come. Then you have to take treatment with hormones. There is no other.
What is the efficacy of this HRT, ma'am? In which way will it help?
HRT is actually good. Immediately something like someone comes with hot flushes, we give HRT, the symptoms just go.
Okay.
So she'll get very used to it also. But at the same time, we have to make sure, her lipid profile is fine. She does the small amount of walking every day, because hormones are, again, they carry risk of blood thickening, like the strokes and all are also there, right? So we have to, nowadays we are getting a very safe friendly HRT with low dose of estrogen and progesterone in them, and we are moving towards bioidentical hormones also.
Okay.
So this bioidentical hormones is something like you test the levels of the lady, and finally you give them only so much of hormone which the lady requires, and you titre them on a regular note. So this is more healthy for her rather than just taking a rough dose every day.
Right. You know, just like yesterday we were discussing that tomorrow Maalavika ma'am is coming, and menopause was one of the issue with one of the topic that we wanted to discuss. Now one of the team member was saying that, sir, I've seen some cases in the news where a woman is conceiving at about 80-year-old, 70-year-old, giving birth to kids. So why does this happen?
It is with IVF. I mean, now you are there are so many inventions, new things which are happening with life. So obviously new things everyone is trying. So when a 80-year-old woman, I don't know how far it's possible, but whatever, when an elderly lady, when she wants to conceive, you have to, obviously she's attained menopause already. She doesn't have any hormones. So the embryo should be either hers, or you go for donor ovum, donor egg. Okay. So if she did her egg freezing at a younger age, then she can use her own egg. But if she doesn't have an egg right now, she has to take a donor egg and then make an embryo. And then go for IVF. And IVF involves a lot of hormonal boosting, and top of that her health condition. So all that maintained, finally she needs, and finally the baby also will be young. There's a lot of age gap. So depending on what they want, they'll take a call. Now who are we to judge that?
Okay. Thank you so much for this insightful conversation. A lot of issues that women per se are hesitant to discuss with their own families or their own friends. So all those issues, most of them, you have tried to spread some awareness and given them genuine advice. Thank you so much.
Thank you, Shashank.